Dr. Henry Konopanicki is a doctor specialising in geriatric medicine. He's a consulting physician at the Aberfield Aged Care in Melbourne. Now, the doctor has been the centre of a recent trial around rapid testing at the aged care facility. The trial is proving to be an overwhelming success, and today we'd like to welcome Dr. Konopanicki via Zoom. How are you, Doctor?
Good morning. I'm very well, thank you.
That's good. You're looking fit and healthy and ready to go.
I certainly am.
Okay, so the rapid testing trial that you're doing, what was the instigation of that? Why did we start with that?
Okay, so we were one of the first residential care facilities to lock down, when the initial outbreak in China. So we've had really good success. We have high quality PPE, etc. But the problem is that there's three cases here. So there's the residents that are really unwell, then the staff that are working a number of different sites, and then people coming in. So it's all very well to do a COVID PCR test, but that's when the horse is bolted. So now that we've moved on to the Delta virus and sporadic outbreaks, and that was shown by the example yesterday of that school where a school teacher in her 20s was tested positive, that you don't know where it is. So it's very naive to think, when they say there are no cases today in Victoria, that means no cases in the sample that was tested, and that was proved yesterday because that person hadn't been in that sample. So we're dealing with a very vulnerable group of people that have maintained their care and their health. So we were looking at, and I was interested in doing a screening test. So the rapid antigen test is a screening test, and what it does is heightens the level of confidence. So it doesn't exclude anything, but it's just another means to maintain a safety in a situation where you have very high risk people.
Mm. Sometimes, am I right in saying sometimes there's a big lag between being tested and turning up at work in an aged care facility where you could pick it up, where the rapid testing seems to have some advantages?
Yeah, so it does have advantages because if you so with the rapid antigen testing with staff, we go through a whole process, and first of all they've got to be asymptomatic. So if they're not, they're asked to leave, and they know that they shouldn't be here in the first place. So the rapid antigen testing is a good test for those people that are asymptomatic. So you don't know if you're carrying the virus. And secondly, even if you're vaccinated, we know there's a 10 to 20% chance of carrying the virus and shedding and transmission. So this is a good screening test. Nothing's absolute, but it brings to your attention very quickly. So and also it's at 10 minutes as opposed to 8 to 24 hours.
Yeah. Do you have any data so far from the testing as regards to the performance of those tests compared to PCRs?
So in the facility, where, as I said, there are two cases, and the third case with visitors and contractors, we're in the process of setting up protocol because you can't mandate. So we're looking at procedures, etc. So with the residents and the staff, the PCR tests are negative, and the rapid antigen tests have been negative as well. And in one particular case, we had a lady who had pneumonia. So we did the rapid antigen test, we did the PCR. Rapid was negative, and then next day the PCR test came back as indeterminate. So no one knew what that meant. So we continued to do rapid antigen testing, which was negative, and then 48 hours we got a PCR result, which was negative. So the more we use it, the more experience and the more acceptance we have of the result.
It definitely seems like that would have been a case where it may have been a big save. Fortunately, it was a negative result on both, but had it have been the other way, you would have picked it up a good 24 hours before the PCR test.
Yes. So we're not replacing anything. So if the rapid antigen test is positive, so there is what they call, some people will come positive on the rapid antigen. If they do the PCR, it may be negative. So if the rapid antigen is positive, then you need to go on and do, at the moment, you need to go and do a COVID-19 PCR test.
So and again, I'll defer to your expertise rather than Dr. Google. To me, this seems very similar, just like to any roadside breath test, where you give an initial indication on the breathalyzer, then you're asked to front for a more accurate determinate test in the van, apparently, not that I have any experience apart from television, or the same as a home pregnancy test, where you get an indication with a test and then you go off for confirmation. So we're not really trying to replace the PCR. It actually emphasises it as part of the armoury, doesn't it, Doctor?
Absolutely. So it's a screening test, and we have multiple. And a par excellence is the prostate blood test, which is a screen. And just because you have an increased a certain result, it does not necessarily mean you've got prostate cancer. So you need to go on and have further definitive testing. So this is part of a whole package: PCR, rapid antigen, social distancing, wearing masks, and the most important thing, which is not heightened, is public hygiene, which leaves a lot to be desired.
What do you think? There's been a bit of a resistance, or at least a slow to get on board with the rapid antigen testing?
Suppose, in Australia, we tend to be a little bit slow. There's a push. So I'm an ex-chemical pathologist, and I know when there was point of care testing, when GPs were able to do tests in their practices, there was a bit of resistance because the accuracy, sensitivity of testing. So that's why there's always been that push against that. So there are medical reasons, I suppose, in the profession with the College of Pathologists not coming on board, but they need to understand, just like any other test, it's a screening test. It does have a place. We're not replacing anything. We're just adding to the matrix.
So the other interesting or curious fact that I want to know, Doctor, is who pays for the PCR tests? Apparently, am I right in assuming that they're quite expensive compared to the rapid antigen testing?
Right. So people think, it's free. Yes, it is free. You don't have to pay, but the pathology companies are billing the Commonwealth. So between $80 and $100 per PCR. So you do the maths. So in Queensland yesterday, there were 52,000 PCR tests. So you work out what the cost of that. So overall, the cost has been hundreds of millions of dollars, as opposed to a rapid test that, depending on that, is roughly about $10. So if the rapid antigen test was going to minimise the number of PCRs, so you've already got an economic cost benefit already. So you need to look at, when the laboratories talk about the sensitivity of a test, you're talking about the numbers, how many it detects, but then you look at the economic sensitivity, and that relates to the economic benefit, the economic cost, and the clinical outcome of the test. So yes, that's something that needs to be addressed, and I don't think the public are aware of the cost that's involved. And at the end of the day, we are paying for it.
Gee, that's an incredible disparity there for not much benefit. As far as the accuracy goes, what sort of percentage are we talking about, Doctor?
So once again, you have what's called false positives, those results that come up as a positive test, but when you do the PCR, it's negative. So, and we need to do more to try and understand what that means. But the main thing is, in a vulnerable situation, is you want, if it's negative, it's negative. So you're looking at about a 99% true negative result, and that's the important point. So, for instance, in building sites, schools, workplaces, residential care, it's not of consequence if a result comes up positive and then turns out to be negative on the PCR, because what you want to do is you want to avoid anyone that is truly positive coming in to that particular environment. And I suppose if we'd done that previously, we may have been able to minimise some of the issues in residential care.
So it would seem to be a no-brainer for the more marginalised segments of our society who are often have that conflict of, gee, I need to go to work, but I've got the sniffles. But if I take the whole day off to get a test and it's negative, whereas if this was available to them either at home through a chemist and they had the opportunity to know the results within 10 minutes and have some sort of reasonable certainty to then be able to go out, it would seem that the compliance with some of the other measures would be a lot more easily facilitated.
Absolutely. And not only that, so that if someone had the sniffles, right, and they did a PCR, it was negative, they could do that a number of times a day. So it may end up that it turns out to be positive. So you're picking that up prior to getting a result from PCR. Now in America, Amazon are now selling home kits for $30 American.
We also see that also where in the hotel quarantine where people are testing negative until day 13 and then suddenly testing positive, and that's with the PCR test.
Yes. And so that's another issue because as the time frame in the tail end there, we're still not 100% sure, are people shedding or are people truly infectious? And that may be another role of yet to be determined of rapid antigen testing, that if that's negative, because does that mean that even though PCR is positive and the antigen test is negative, that maybe they're not infectious, it's just shedding. And bear in mind also, these particular tests also run internal controls, which means for each batch, just like in a laboratory, you can run a positive sample and a negative sample, and that will also confirm that your test is running appropriately.
All right, Doctor, when do you think we'll have some of the results from your trial?
So we're already, for the results so far, we're doing a parallel PCR and rapid antigen, and they are all been negative. And I've also started another sub-trial. I'm working in a boarding house. We're very vulnerable, a lot of mental health, people going out picking up butts, and now we've started rapid antigen testing there on a random basis with PCR testing as well. So far there's been very good correlation. So we haven't had any results that don't confirm each other.
Well, thanks so much, Doctor. It's been a fascinating chat, and it really seems like this is a no-brainer.
Yeah, I think, and once again, as I said, this is not replacing anything. It's just increasing the security and the assurance at a minimal cost. And it may also, if you have a look, as I said before, because of the cost of the rapid antigen, you may find that it has an economic benefit as well as a health benefit.
Great. Well, thanks so much for your time today, Doctor, and I'll look forward to seeing further tests from you.
No, my pleasure. Thank you. All the best.